अस्सलाम वालेकुम स्टूडेंट्स। तो आज हम डिस्कस करते हैं टिश्यूज़ रिपेयर एंड द वाउंड हीलिंग। इसका मतलब ये है कि अगर हमारे साथ एक टिश्यू है और वो इंजर्ड हो जाए तो उसकी रिकंस्ट्रक्शन किस तरह से होती है। तो सबसे पहले हमारे साथ है रिपेयर। रिपेयर को हम डिफाइन करते हैं एज द रिस्टोरेशन ऑफ द नॉर्मल आर्किटेक्चर एंड फंक्शन ऑफ द टिश्यू आफ्टर इंजरी इज नोन एज रिपेयर। और रिपेयर हमारे साथ दो तरीकों से होता है। सबसे पहले रीजेनरेशन, दूसरा हमारे साथ है स्कारिंग। Regeneration occurs when the injury is mild in nature of the tissue injured as labile are having the stable cell that have the ability to divide continuously and reconstruct the injured area. दूसरा हमारे साथ है scarring. Scarring occurs when the tissue injured is more severe or there are no residual parenchymal cell for the division of the replacement of the injured tissue or the tissue injured is permanent type and they have no dividing cell. तो सबसे पहले हमारे साथ है repair by the regeneration. Regeneration को हम डिफाइन करते हैं as the replacement of the damaged tissue by the parenchymal cells of the same type is known as regeneration. And the regeneration occur either from the stem cell or from the proliferation of the residual undamaged parenchymal cells. And the stem cell are the undifferentiated cell, and they have the ability of self-renewal, and they also have to the potency to generate the specialized cell type. Let's suppose अगर ये हमारे साथ stem cell है तो ये divide होता है and they produce a cell of the same type to maintain its own germline, and similarly they also differentiate to produce specialized type of cells. On the basis of the regeneration capacity, the cells are divided into the three types. First one हमारे साथ है labile cells. Labile cells are the continuously dividing cell, and these cells proliferate throughout the life, and they replace the damaged cell. The example include the stratified squamous epithelium of the skin, oral cavity, or the vagina. These epithelial cells divide continuously and they replace the damaged one. Second one is cuboidal epithelium of the ducts draining the exocrine glands like salivary gland or the biliary duct. तीसरा हमारे साथ है columnar epithelium of the GI tract, and the last one is hemopiotic stem cell of the bone marrow that produces continuously the various type of the blood cell. So all of these cells have the ability to divide continuously and replace the damaged one. दूसरा हमारे साथ है quiescent cells. Quiescent cells are also known as the staple cells, and these cells are present in the G-night phase and they do not divide normally, but whenever there is any tissue injury occur, then these cells enter into the G1 phase and they start dividing. And the example include parenchymal cells of the pancreas or the kidney, or the mesenchymal cells that include the smooth muscle cell, cartilages, and the vascular endothelial cell. These cells do not divide normally, but whenever they are damaged, then they start replicating and enters into the G1 phase and they replace the damaged cell. तीसरा हमारे साथ है permanent cells. So permanent cells are the non-dividing cells, and these cells are fully differentiated, and these cells do not replicate once they are damaged, and these cells are replaced by the scarring. The examples include the nerve cell, cardiac cell, and the skeletal muscle cell. And all of these cells, when they are injured, they do not divide and they are replaced by the scarring of the tissue. अब हम बात करते हैं about the cellular proliferation. So the cellular proliferation is controlled by the various growth factors, and these growth factors may be stimulatory growth factors that increases the growth of the tissue, or the inhibitory growth factors that causes inhibition. The stimulatory growth factors include epidermal growth factors, platelets-derived growth factors, fibroblast growth factors, vascular endothelial growth factors, cytokine like interleukin-1. दूसरा हमारे साथ inhibitory growth factors that include the transforming growth factor beta, etc. And these growth factors are released either from the residual undamaged cells or from the macrophages, the endothelial cells, and the extracellular matrix. दूसरा हमारे साथ है the repair by the scarring. So the scarring occurs when the injury is more severe in nature and there are no residual cell remaining for the regeneration. Or the scarring occurs when the injured tissue is permanent in nature and there are no dividing cell. Then the damaged tissue is replaced by the scar. अब हम बात करते हैं about the phases of the scar formation or the steps involved in the scarring. Initially जब हमारे साथ एक tissue injure होता है तो वहाँ से हमारे साथ क्या होती है, bleeding होती है, and this bleeding is controlled by the process of the coagulation, and the coagulation occurs due to activation of the platelets and the clotting factors that causes the formation of a blood clot. After the blood clotting, then the process of the inflammation begin, and this inflammation remove the necrotic debris of the necrotic tissue, and the inflammation also induces the process of the repair. And the inflammation involve different types of cell. Initially, there are neutrophils and Later on, these neutrophils are replaced by the macrophages, and the macrophages have two types: M1, which are the classically activated macrophages. They are involved in the process of inflammation, and the M2 cells, which are the alternatively activated macrophages. They causes the repair of the tissue. दूसरा हमारे साथ है preparation, and preparation there is removal of the inflammatory exudate by the lymphatics, and the injured area is prepared for the scarring. तीसरा है formation of the ingrowth of the granulation tissue. So the granulation tissue is formed at the injury site, and they fill the injured area. And the granulation tissue is highly vascularized connective tissue, and it is composed of proliferating cells that include the endothelial cell, which form the new capillaries by the angiogenesis. दूसरा हमारे साथ है fibroblast cells. They lay down the collagen in the injured area. तीसरा हमारे साथ है proliferating epithelial cells of the parenchyma, and the residual inflammatory cells, which causes inflammation and the tissue repair. And the granulation tissue is induced by fibronectin, which is a glycoprotein that play a key role in the formation of the granulation tissue. And initial phase, this fibronectin, which is a glycoprotein, is present in the plasma, but later on it is synthesized by the fibroblast cell macrophages, and the extracellular matrix cell are the endothelial cell. इसके बाद हमारे साथ आता है ग्रेनुलेशन के बाद collagenization. So collagenization is also known as the fibrosis, and this process there is deposition of the collagen occur, and the collagen is a major fibrillary protein of the connective tissue, and this collagen is synthesized by the fibroblast cell, and fibroblast cells is responsible for most of the tensile strength of the scar or the injured area. And these fibroblast cells are activated by the tissue's growth factor beta, which is involved in the migration of the fibroblast cell, activation of the fibroblast cell, and proliferation of the fibroblast cell. Hence the tissue growth factor beta that promotes the process of the scar formation. इसके बाद हमारे साथ है maturation of the scar. Initially there is a formation of the young scar occur, and this young scar is highly vascular and highly cellular, and it appears pink on the gross examination. But later on, when the scar mature, it becomes less vascular and less cellular due to the deposition of the large amount of the collagen. And when the scar becomes fully mature, it is avascular in nature, and it is a poorly cellular mass, and it appears white on the gross examination. आखिर में हमारे साथ आता है contracture and the strengthening of the scar. It depends on the fibroblast cell. The fibroblast cell they produces myofibrils, which have the actin protein, and this protein have the property of the contraction. And when they contract, they bring the two injured area together and decreases the size of the scar and make the scar more strengthened. तो स्कारिंग में इनिशियली जब हमारे साथ टिश्यू इंजर होता है तो वहाँ पे ब्लीडिंग होती है, फिर ब्लड क्लॉट फॉर्म होता है, फिर उसके बाद इन्फ्लेमेशन स्टार्ट हो जाती है जो कि हमारे साथ नेक्रोटिक एरिया को रिमूव करता है और हमारे साथ टिश्यू रिपेयर को स्टार्ट करता है. फिर उसके बाद हमारे साथ ग्रेनुलेशन टिश्यू की फॉर्मेशन होती है, एंड ग्रेनुलेशन टिश्यू इज अ हाईली वास्कुलराइज्ड कनेक्टिव टिश्यू दैट इज कंपोज्ड ऑफ proliferating endothelial cell, fibroblast cell, and the epithelial cell. और ग्रेनुलेशन टिश्यूज के बाद फिर हमारे साथ collagenization होता है, and there is more deposition of the collagen occur in the granulation tissue, and it form a scar. Initially, there is formation of the young or the immature scar occur, which is highly vascularized, but later on, when the scar become mature, it become avascular, and it is polycellular. And later on, there is a contracture and the strengthening of the scar occur, which depend on the fibroblast cell that produces myofibrils, and they contract and they bring the injured area together and decreases the scar size of the scar. अब हम बात करते हैं about the remodeling of the tissue. So the remodeling there depends upon the balance between the extracellular matrix deposition and the degradation of the collagen. Normally there should be a balance between these two processes. The degradation of the collagen occur with the help of an enzyme known as matrix metalloperoxidase enzyme, and this enzyme is zinc dependent. If there is deficiency of the zinc occur, then there will be impairment in the process of the wound healing. And the matrix metalloperoxidase enzyme is released from fibroblast cell, macrophages, neutrophils, synovial cells, and the epithelial cell. To prevent the overactivity of the matrix metalloperoxidase enzyme, there is another enzyme known as tissue inhibitor of the matrix metalloperoxidase enzyme. This enzyme is released from the mesenchymal cell, and it regulates the activity of matrix metalloperoxidase or the collagenase. Hence, for the tissue remodeling, there should be the regulated activity of this matrix metalloperoxidase enzyme and the tissue inhibitor of the matrix metalloperoxidase enzyme. अब हम बात करते हैं about the healing. So healing is a complex fibroproliferative process that patches up the injured area, and the healing occurs by two methods. One is the healing by primary intention, which is also known as healing by primary union. and second one is healing by secondary intention, which is also known as healing by secondary union. तो सबसे पहले हम डिस्कस करते हैं healing by the primary union. It occurs when there is minimal damage to the tissues occur and there is less blood loss and the wound produced is clean cut, unimpacted, and it has a good opposing edges like a clean surgical wound, and there is lesser necrotic tissue formation occur and the inflammatory reaction produced is minute in nature, and in healing by primary union the healing occur very rapidly, and there is more cellular proliferation occur and the scar formation is less in healing by primary intention, and similarly there will be no wound contracture occur. दूसरा हमारे साथ है healing by secondary intention. So it occurs when there is significant loss of tissue occur and the wound produces open edges. The example include open wound. Here there is maximum damage to the tissue occur, so there will be more bleeding occur and the process of healing is slow, and there will be a large amount of the granulation tissue form, and the inflammatory reaction is also more intense, and there will be more scar formation occur, and there is also the wound contracture present. तो अब हम बात करते हैं about the complications of the wound healing, और उसमें सबसे पहले हमारे साथ है infection of the wound. दूसरा हमारे साथ है dehiscence of the wound. Dehiscence means separation or bursting of the wound, especially that of the abdomen. तीसरा हमारे साथ है excessive formation of the repair wound, and it include keloid formation, hypertrophic scar, and the proud flesh. Keloid formation occur due to excessive collagen deposition, and it present as a protruding tumor scar, in which the scar they extend beyond the margin of the wound. दूसरा हमारे साथ है hypertrophic scar. It also occur due to the excessive collagen deposition, and it present as a raised scar, but the scar remain within the confine of the wound, and it does not extend the margin of the wound. तीसरा हमारे साथ है proud flesh. So the proud flesh also occur due to the excessive granulation tissue, and it extends above the level of the skin, and hence it's block the re-epithelialization. So keloid and hypertrophic scar occur due to excessive collagen deposition, and the proud flesh occur due to excessive granulation tissue. And the fourth one is formation of the contracture. So the contracture are seen in severe burn injury that are produced on the palms and the sole. तो अब हम बात करते हैं about the mechanism of the wound healing. On day zero, when the injury has occurred, initially there will be bleeding occur from the injured side, then followed by formation of the blood clot in the incised area. And this blood clot is known as coagulum that occur due to activation of platelets and the coagulation factor. Then on day one, there will be neutrophilic infiltration occur along with the blood clot formation. On day two, there will be continuous thin epithelialization occur along with neutrophilic infiltration and the blood clot. When the blood clot dries up, then it is known as the scab. On day three, the macrophages they replaces the neutrophil. Similarly, there is also appearance of the granulation tissue occur, and the granulation tissue consists of proliferating epithelial cell, endothelial cell, and fibroblast cell. Similarly, there is also deposition of the type 3 collagen occur, but there will be no bridging occur between the incised area. And day 5, the granulation tissue they increases in size. Similarly, the collagen fibers they bridges the incised area, and the new vascularization is maximum at day 5. Similarly, there will be full epithelial thickness occur along with the surface keratinization. At the end of the second week, there will be fibroblast proliferation occur and the collagen deposition occur, and at the end of 1 month there is replacement of the type 3 collagen occur with the type 1 collagen, and the type 1 collagen has more tensile strength than this type 3 collagen. अब हम बात करते हैं about the factors affecting the wound healing. So they include both the systemic factors and the local factor. तो सबसे पहले हम बात करते हैं about the systemic factors. They include nutritional deficiency, like if there is deficiency of the protein occur, then the collagen synthesis will decrease. Similarly, vitamin C, which is required for the cross-linking of collagen. So if vitamin C deficiency occur, there will be no collagen cross-linking occur. Similarly, the zinc, which is required for the activity of matrix metalloperoxidase enzyme. So when zinc is deficient, the wound healing will be impaired, or the tissue remodeling will be impaired. And the blood factors include neutropenia, hemorrhagic diathesis, anemia, low plasma protein like immunoglobulins, and the complement protein. All of these factors also impair the wound healing. Similarly, the diabetes mellitus. So in diabetes mellitus, the patient have low immunity. Similarly, the blood supply toward the lower limb is impaired, especially towards the lower limb is impaired, and the glucose content is also high, which favors the blood bacterial growth. So the diabetes mellitus also impair the healing of the wound. इसके बाद आता है हमारे साथ हार्मोन्स. तो द एड्रीनल कार्टिकोस्टेरॉइड हार्मोन they decreases the process of healing by stabilizing the lysosomal membrane Similarly, they also suppresses the immunity and also block the release of the tissue growth factor beta. So hence this corticosteroid hormone decreases the wound healing. Similarly, with the increase in the age, the process of wound healing decreases, and the temperature, when the temperature is very low, then the healing process will also be low due to the less perfusion. The second one is the local factors. So the local factors also impair the process of the wound healing, like local infection in the wound, poor blood supply toward the site of the injury that decreases the healing, and the poor blood supply occur due to arteriosclerosis, varicose vein, other venous thrombosis. Is it the presence of the any foreign body in the wound? They also decreases the healing process, and if there is local pressure on the wound, they may also cause a separation of the wound and decreases the healing of the wound. Is it if there is movement of any injured area occur, it may delay the process of the healing. And there are also certain other factors like edema, X-rays, UV light exposure. They also hinder the process of the repair. So it was all about the tissue repair and the healing.